Avoid cucumbers if you are on these medications. If you're a fan of fresh, crisp cucumbers, you might want to think twice before adding them to your diet if you're on certain medications. Cucumbers are often hailed as a healthful, hydrating vegetable with a wealth of nutritional benefits, from their high water content to their array of vitamins and minerals. But did you know that for some people, particularly those on specific medications, cucumbers can potentially interfere with their health regimen? In today's video, we're diving into why cucumbers, despite their many health benefits, could pose risks when combined with certain medications. We'll cover 5 categories of medications where cucumbers might not be the best companion. We'll equally explore how cucumbers can affect the effectiveness of these treatments and what you need to be aware of to keep your health on track. Let's start with a real-life example to set the stage. Meet Sarah, a 45-year-old woman who loves incorporating cucumbers into her meals for their refreshing taste and health benefits. She was managing her condition with a combination of medications, but noticed some troubling symptoms that led her to question whether her diet could be the culprit. After some research and consultation with her healthcare provider, Sarah learned that cucumbers were interacting with her medication in ways she hadn't anticipated. In this video, we'll break down how cucumbers can interact with various types of medications, including anticoagulants, diuretics, thyroid medications, diabetes medications, and antihypertensives. We'll provide you with scientifically backed information and practical advice on how to manage your diet if you're on these medications. Stay tuned as we uncover the reasons why you might need to limit or avoid cucumbers in your diet, ensuring that your medication remains effective and your health stays in optimal condition. Make sure to hit that subscribe button and ring the notification bell so you don't miss out on this crucial information. Let's get started. Number 1. Antihypertensives. Antihypertensive medications are essential for managing high blood pressure. Hypertension, a condition that can lead to serious health complications such as heart disease, stroke, and kidney damage. These medications work in various ways to lower blood pressure, but their effectiveness can be influenced by dietary choices, including the consumption of foods like cucumbers. Here's a closer look at how cucumbers might interact with antihypertensive medications and what you should consider. Cucumbers are low in calories and high in water, making them a popular choice for hydration and weight management. They also contain potassium, an essential mineral that helps regulate blood pressure by counteracting the effects of sodium. However, there are some considerations when combining cucumbers with antihypertensive medications. Cucumbers contain potassium, which is beneficial for blood pressure control. However, if you are on potassium-sparing diuretics or certain other antihypertensive medications, consuming too much potassium can be problematic. Elevated potassium levels can lead to hyperkalemia, a condition that can affect heart function and overall health. For those on diuretics, it's essential to balance potassium intake. Cucumbers can contribute to your daily potassium intake, but if your medication alters potassium levels, consult your healthcare provider to adjust your diet accordingly. Be mindful of your potassium levels, especially if you are on medications that affect potassium balance. Maintain a balanced diet and consult with your healthcare provider to determine the right amount of potassium for your condition. Number 2. Anticoagulants. When managing blood-thinning medications, maintaining a consistent diet is crucial. Anticoagulants, such as warfarin, are commonly prescribed to reduce the risk of blood clots and prevent stroke, heart attack, and other serious cardiovascular events. However, these medications require careful monitoring of dietary intake, including the consumption of certain vegetables like cucumbers. Cucumbers are generally considered a healthy addition to most diets due to their high water content, vitamins, and minerals. However, they contain certain compounds that may interfere with the action of blood thinners. Specifically, cucumbers have a high content of vitamin K, a nutrient known for its role in blood clotting. Vitamin K can counteract the effects of anticoagulants, potentially reducing their effectiveness in preventing blood clot formation. Research has shown that vitamin K plays a key role in the synthesis of clotting factors in the liver. Anticoagulants like warfarin work by inhibiting vitamin K's role in this process, thereby reducing clotting. Studies indicate that a sudden increase or decrease in vitamin K intake can disrupt the delicate balance required for effective anticoagulation therapy. According to a study published in the American Journal of Clinical Nutrition, patients on anticoagulants should maintain a stable intake of vitamin K to avoid fluctuations in their medication's effectiveness. Number 3. Diuretics. Diuretics, commonly known as water pills, are a class of medications prescribed to help manage conditions such as high blood pressure, heart failure, kidney problems, and edema, swelling. They work by promoting the removal of excess sodium and water from the body through urine, thereby reducing fluid buildup and lowering blood pressure. However, when consuming foods like cucumbers while on diuretics, there are specific considerations to keep in mind. Cucumbers are predominantly water, about 95%, and contain potassium, a key electrolyte. Here's how these characteristics interact with diuretics. Potassium-sparing diuretics are designed to help maintain potassium levels in the body. Cucumbers, being a good source of potassium, can be beneficial in balancing potassium levels, especially if you're on these types of diuretics. However, it's important to monitor your total potassium intake to avoid potential imbalances. Maintaining appropriate potassium levels is crucial for cardiovascular health, particularly when on diuretics that affect potassium balance. Diuretics increase urine production, which can lead to dehydration if not managed properly. Cucumbers, with their high water content, can contribute to hydration and help counteract the dehydrating effects of diuretics. Proper hydration is essential to avoid dehydration and maintain overall health. Staying hydrated while on diuretics is crucial to support kidney function and overall fluid balance. Diuretics affect not only potassium levels, but also other electrolytes like sodium and magnesium. Cucumbers can aid in maintaining electrolyte balance due to their low sodium and high potassium content. This can be particularly helpful in preventing electrolyte imbalances, which are a common concern with diuretic use. Before we move on to the next important point, I want to take a quick moment to remind you to subscribe to our channel. It really supports our work and allows us to continue bringing you valuable information. So, if you haven't already, hit that subscribe button so you don't miss out on anything. Now, let's dive into the next point. Number 4. Thyroid medications. Thyroid medications are essential for managing conditions related to thyroid dysfunction, including hypothyroidism and hyperthyroidism. These medications help regulate thyroid hormone levels, which are crucial for maintaining various bodily functions, including metabolism, energy levels, and overall well-being. When taking thyroid medications, the choice of diet, including foods like cucumbers, can play a role in managing these conditions. Cucumbers contain goitrogens, substances that can interfere with thyroid function by inhibiting iodine uptake, which is essential for thyroid hormone production. Although the goitrogenic effect of cucumbers is relatively mild compared to other vegetables like broccoli or cabbage, it's still worth noting, especially for those with thyroid issues. According to research, goitrogens in large quantities can impact thyroid function, particularly in individuals with iodine deficiency. Thyroid medications, particularly those used to treat hypothyroidism, rely on adequate iodine levels to function effectively. Cucumbers are low in iodine, which is generally beneficial, but for individuals with thyroid issues, maintaining a balanced diet that supports iodine absorption is important. A study in thyroid research emphasizes the need for a balanced iodine intake for optimal thyroid health and medication efficacy. Number 5. Diabetes medications. Diabetes is a chronic condition that affects how your body processes blood sugar, glucose. Managing diabetes often involves a combination of lifestyle changes, including diet and medication. Diabetes medications help regulate blood sugar levels, and it's essential to be aware of how certain foods, including cucumbers, can interact with these medications. Cucumbers are rich in vitamins and minerals, including vitamin K and potassium. These nutrients can support overall health, but it's essential to monitor how they interact with diabetes medications. For instance, high potassium levels can be a concern for individuals on certain diabetes medications that affect kidney function. The Journal of Clinical Endocrinology and Metabolism highlights the importance of balancing potassium intake to avoid potential complications. Cucumbers also contain fiber, which is beneficial for digestive health. However, for individuals on diabetes medications that affect digestion or those with gastrointestinal issues, the fiber content might need to be considered. Cucumbers are generally considered a low-calorie, hydrating vegetable with minimal impact on blood sugar levels. However, it's essential to understand how cucumbers might interact with diabetes medications. Navigating dietary choices while managing medications can be complex, but understanding how specific foods like cucumbers interact with your prescribed treatments can significantly impact your overall health and well-being. Throughout this article, we've explored how cucumbers can affect various types of medications, from blood thinners and diuretics to thyroid medications and diabetes drugs. Incorporating cucumbers into your diet can offer numerous health benefits, including improved hydration and added nutrients. However, if you're on specific medications, it's crucial to be mindful of potential interactions and consult with your healthcare provider to tailor your diet to your individual needs. Understanding the interplay between diet and medication empowers you to make informed choices that enhance your health and treatment outcomes. By being aware of how cucumbers and other foods interact with your medications, you can better manage your condition and support your overall well-being. We hope this article has provided valuable insights into managing your health while taking medications. For more tips on how to optimize your diet and medication regimen, be sure to subscribe to our channel. Hit the notification bell so you never miss out on our latest content. Share your thoughts, experiences, or questions in the comments below. We will love to hear from you. Stay tuned for more videos that explore how to make informed dietary choices and manage your health effectively. Thank you for watching, and take care of your health.